Washington, D.C. May 2025, WorldWire News. In a move that has sparked nationwide debate, the U.S. Food and Drug Administration, FDA, is moving to ban all ingestible fluoride supplements prescribed for children, including tablets, drops, and lozenges. The agency's decision, set to be finalized by October 31, 2025, is based on growing concerns over potential health risks and the lack of formal FDA approval for these products. While many parents, dentists, and pediatricians are alarmed, others hail the ban as a long-overdue step toward re-evaluating the widespread use of fluoride, particularly its impact on young, developing bodies. Magnifying glass. Why is the FDA targeting fluoride supplements now? Fluoride supplements have been commonly prescribed for children, especially those in low-fluoride areas, to prevent cavities and promote oral health. These products were introduced decades ago and widely used without undergoing the rigorous approval process now standard for pediatric medications. Recent research, however, has cast doubt on their safety. Studies link ingested fluoride to potential risks such as thyroid dysfunction, disruption of gut microbiota, and even lower IQ scores in children. A growing body of evidence also suggests that fluoride's benefits are primarily topical, making ingestion unnecessary, and potentially harmful. Health and Human Services Secretary Robert F. Kennedy Jr., a vocal critic of environmental toxins, supports the FDA's move, citing evidence that fluoride functions as a neurotoxin in certain doses. "We must reassess long-held assumptions," Kennedy said. "Fluoride in toothpaste is enough. Swallowing it is another matter entirely." Tooth opposition from the dental community. Unsurprisingly, the American Dental Association, ADA, has pushed back strongly. The ADA argues that fluoride supplements, used correctly, do not pose significant risk and are critical in preventing cavities in children from underserved communities. Removing these options could leave low-income children without effective cavity prevention, the ADA warned in a recent statement. The cited studies don't represent real-world exposure levels. Their concerns highlight a bigger public health tension: how to weigh emerging scientific caution against long-standing preventive practices, especially when it comes to children. Brain public health implications. The potential withdrawal of fluoride supplements has several cascading effects. 1. Reduced access for vulnerable populations. Children in rural or low-income areas, where community water may not be fluoridated, often depend on supplements. Removing them may widen health disparities, especially among those without access to regular dental care. 2. Increased pressure on topical alternatives. With ingestible fluoride likely off the table, public health efforts will have to double down on topical fluoride delivery, such as toothpaste, mouth rinses, and professional treatments. 3. Legal and regulatory precedent. The FDA's action could set a precedent for re-evaluating other long-standing medical practices that were normalized before modern scientific scrutiny. This signals a broader shift toward precautionary public health regulation. Receipt. What are the safer alternatives for parents? If the FDA finalizes the ban, parents still have a number of effective, safer tools to protect their children's teeth. Checkmark 1. Fluoride toothpaste. Age-appropriate use. Using pea-sized amounts of fluoride toothpaste under supervision has been shown to be safe and effective. The key is to teach children not to swallow the paste. Checkmark 2. Topical fluoride varnish. Many pediatricians and dentists offer fluoride varnish treatments that are applied directly to the teeth. These are safe, require no ingestion, and have a strong protective effect against cavities. Checkmark 3. Diet and oral hygiene. Limiting sugary snacks, encouraging regular brushing and flossing, and incorporating calcium and phosphate-rich foods like dairy products can significantly reduce cavity risk. Checkmark 4. Fluoride mouth rinses. For older children, for children over 6 years old, fluoride rinses can be a useful part of an oral hygiene routine again, without swallowing the substance. Checkmark 5. Community fluoridation. In communities where the water supply isn't fluoridated, local governments may now face pressure to revisit public water fluoridation programs, especially as supplements become less available. Speech balloon. The bigger question. Rethinking preventive medicine. This decision isn't just about fluoride, it's about how medical consensus is formed, updated, and challenged. The FDA's action signals that long-standing norms aren't immune to scientific scrutiny. It reflects a system willing to pivot when credible concerns arise, especially where child safety is involved. But it also presents a challenge. How can public health protect children without unintentionally widening the gap between those with access to dental care and those without? Compass conclusion. Precaution, not panic. The FDA's proposed fluoride ban is not a reason for panic, but it is a reason for parents, educators, and healthcare providers to educate themselves, review alternatives, and demand clear, evidence-based guidance going forward. For now, the safest bet remains topical fluoride, good hygiene, and regular checkups. As the science continues to evolve, so too must our practices, because when it comes to children's health, precaution is always better than cure. By WorldWire News Health and Policy Desk for insight. For protection. For the future.